Hello friends, today we are going to discuss another program which is hypertension and treatment, natural treatment rather. Hypertension is called high blood pressure. What is hypertension or high blood pressure? Hypertension is defined as a persistent increase in blood pressure above the normal range of 120 systolic and 80 diastolic millimeter of mercury. The prevalence of hypertension increases with advancing age. The persistent and chronic elevated arterial pressure causes marked pathological changes in the vasculature and heart. How strongly blood pressure against arterial wall of the body. Systolic, when heart beats to pump out. Diastolic, when heart rests in between beats. That is called systolic and diastolic blood pressure. Statistics. Hypertension affects 1 in 3 adults worldwide. It affects men more than women. Affects poor population more than others. Hypertension is implicated in 13% deaths worldwide. Let's see what is normal blood pressure. Normal blood pressure, when it is less than 120 over 80, 120 systolic and 80 diastolic. Elevated blood pressure is 120 to 129 systolic and less than 80 diastolic. Stage 1 high blood pressure is 130 to 139 systolic and 80 to 89 diastolic. Stage 2 high blood pressure is 140 and above systolic, 90 and above diastolic. Hypertension crisis is when higher than 180 systolic and higher than 120 diastolic. It's a serious condition and you must see a doctor right away. Accurate BP measurement. When we get the blood pressure of a patient should be seated quietly for 5 minutes before getting it checked. Appropriate sized cuff of the blood pressure instrument should be used. Inflate the cuff 20 to 30 millimeter of mercury above the loss of radial pulse and deflate at 2 millimeter per second downwards. First sound of systolic blood pressure is disappearance of chord cough sound. Phase 5 is diastolic blood pressure. Confirm elevated blood pressure within 2 months. That is stage 1. Shorter for stage 2 if new onset. Types of hypertension. Essential hypertension is when there is headache, tiredness, dizziness, nosebleed. Secondary hypertension, when there is abnormality in kidney blood vessels or there is airway obstruction during sleep or in thyroid disease or you are taking some drugs, ibuprofen or pseudoephedrine. Additional types of hypertension are isolated systolic hypertension, malignant hypertension, or resistant hypertension. What causes hypertension? There are few causes, just like smoking. One who smokes gets hypertension. Being overweight or obese is another cause of hypertension. Lack of physical activity, our sedentary habits may cause hypertension. Too much salt intake in the diet is also contributory to the hypertension. Too much alcohol consumption, more than 1 to 2 drinks per day, may be the cause of hypertension. If there is continuous stress, chronic stress, that may lead to hypertension. In older age, our arterial blood vessels become thickened due to age, and that may be the reason for rather systolic hypertension. Sometimes genetics affect the cause of hypertension. Family history of high blood pressure may be one of the reasons. Chronic kidney disease, all the chronic kidney diseases may be contributory to the cause of hypertension. Adrenal and thyroid disorders are other causes of hypertension. Sleep apnea is one of the causes. Who is more likely to develop high blood pressure? People with family members who have high blood pressure, smokers, comorbidities like diabetes mellitus, pregnant women may have, women who take birth control pills, they have, people over the age of 35 should get their blood pressure checked. People who are overweight or obese, people who are not active, people who drink alcohol excessively, people who eat too many fatty foods or foods with too much salt, people who have sleep apnea. All these I have enumerated. Symptoms of high blood pressure. There may be severe headaches. One of the symptoms is that there may be no symptom at all. We call it silent killer because people don't know about it. They don't have any symptom. It is only when they are seen by a doctor, only then they are found to be having high blood pressure. And I see when they have got symptoms, that is a good sign because they will have some effect, pain or something, and they may go to a doctor and they may get it checked. Only then they will come to know that they have got hypertension. So severe headaches may be there. There may be sudden nosebleed. There may be fatigue or confusion. Vision problems may be there. Chest pain may be there. Difficulty breathing sometimes. Irregular heartbeat may be there. Or they may have blood in urine. Or there may be palpitations in the chest. What is dangerously high blood pressure? Blood pressure readings above 180 systolic and 120 diastolic millimeter of mercury are considered stroke level, dangerously high, and require immediately medical attention. How serious is stage 2 hypertension? A person at stage 2 hypertension is at high risk of coronary heart disease, which can lead to a heart attack or stroke. You will have to have your blood pressure checked regularly and follow a strict regimen that will likely include dietary changes, exercise, and lifestyle changes. Tests for hypertension. Ambulatory monitoring. This is 24-hour blood pressure monitoring. Test is used to confirm if you have high blood pressure. The device used for this test measures your blood pressure at regular intervals over a 24-hour period. and provides a more accurate picture of blood pressure changes over an average day and night. Laboratory tests. Your doctor may recommend a urine test and blood tests, including a cholesterol test. Electrocardiogram Ecg. This quick and painless test measures your heart's electrical activity. Echocardiogram. Depending on your signs and symptoms and test results, your doctor may order an echocardiogram to check for more signs of heart disease. An echocardiogram uses sound waves to produce images of the heart. Now we come to the treatment. Lifestyle and diet. Eating a heart healthy diet with less salt, refined. Use black salt or rock salt. Pakistani salt, we say it. Getting regular physical activity, maintaining a healthy weight or losing weight if you are overweight or obese, limiting the amount of alcohol you drink, eat more potassium rich foods, vegetarian foods, cut back on caffeine, learn to manage stress through mindset techniques, eat dark chocolate or cocoa, quit smoking completely, cut added sugar and refined carbs, eat berries, try meditation and deep breathing exercises, leafy green vegetables with magnesium, take natural supplements like garlic, berberine, whey protein, fish oil, hibiscus, all these. You can use black salt, Himalayan salt, desi ghee, lassi, curd, mustard oil unrefined, once a week only, coconut oil unrefined, sesame oil unrefined. Take herbal tea. Take a glass full of water and put some 10 leaves of holy basil, 2 pieces of cardamom, 2 pieces of cloves, 1 piece of garlic, half teaspoonful of fennel, a pinch full of cinnamon, 2-3 pieces of black pepper. Boil this for 5 minutes and drink it with jaggery and lemon. You can add tea leaves if you so desire in this herbal tea. Take live alkaline water. Put 4 to 5 slices of lemon, 4 to 5 slices of cucumber, 10 leaves of mint, 10 leaves of holy basil, a small piece of garlic in a 2-liter glass jug with water at night. You add same amount of water you have drawn from it for drinking. In summer after 24 hours and in winter after 48 hours, make this water again with the above procedure. Foods to be avoided. Non-vegetarian foods including eggs, all non-vegetarian. Wheat, rice, caffeine, sugar, milk, all refined oils, packaged and processed foods, refined salt, all these to be avoided. Normalize your blood pressure. 85% with hypertension can normalize with simple lifestyle modifications. Drugs, a very important note for drugs. Drugs will not change, modify, or in any way address the underlying cause of your high blood pressure. Very important. More than half taking multi medications still not able to manage their condition. It is related to high insulin leading to high blood pressure. For this, avoiding sugar and grains, getting regular exercise may benefit. Normalize your vitamin D levels. Balancing omega 6 to omega 3 ratio, which is ideal, is 1 to 1. Get fasting insulin levels 2 or 3 only. If more than 5 or more than 10, you have problems of high blood pressure and cardiovascular system disease. Fasting, schedule eating, intermittent fasting, and stop breakfast. Fast benefits are abundant. It normalizes insulin sensitivity, normalize ghrelin levels, promoting human growth hormone. Health fitness is there. It lowers triglycerides, reduce inflammation, and lessening free radical damage to the body. Fasting beneficial impact in longevity in animals is seen via mTOR pathways. Exercise while fasting is very much beneficial for the changes in the body. Insulin resistance. Insulin resistance is the basis of all chronic diseases of aging. It promotes chronic inflammation in the body. For this, use grounding to address inflammation. Grounding means earthing. Keep your body in touch with the earth. You can go barefoot or you can apply earthing to your body. Beneficial changes in heart rate with grounding. It reduces your skin resistance, reduce the level of inflammation in your body. It thins blood, making it less viscous. Zeta potential quickly rise. RBCs more charged, which forces them apart, reducing BP, reducing clot, reducing multi-infarct dementia with all these. These are the benefits of grounding. Avoid wheat and milk, which is so important for our diet in Punjab. So avoid these to help reduce insulin resistance. Wheat is inflammatory for 100% of people. Not only few people, but 100% of people. Some may tolerate, but others may not. It affects brain, skin, and gastrointestinal tract. The effects are cumulative and may appear when there is a weak link and sudden exacerbation. The wheat gliadin affects the gut and give rise to leaky gut. Milk protein casein is similarly inflammatory and produce inflammation. Almost all autoimmune diseases start in the gut. Leaky gut is first formed. It gives to inflammation. Inflammation gives to autoimmune disease. Then there is obesity. Then there is insulin resistance and hypertension. This is the cycle which gives you the hypertension, and it can't be treated with any medicine. It is only the lifestyle change which can benefit you. To help reduce insulin resistance, use millets. Night dinner is just like the lunch. The same millets and same days. Millet diet days wise. Little millet, kutki we call it in vernacular, for 2 days. Barnyard millet, swank for 2 days. Kodo millet, kodra for 2 days. Foxtail millet kangni for 2 days. Brown top millet green kangni for 2 days. These millets you are to take to your satiety. Why millets are important? It contains 8 to 12% of fiber. It's anti-diabetic, helps in weight loss, purifies blood, lowers low density lipoprotein cholesterol, reduces blood pressure and sugar. It's gluten free. It has more magnesium. It's good for hairs. It has got antioxidants in it. There are so many benefits of millets. Concoctions we can take. Take concoctions of bay leaves daily for 1 week in the morning. Take concoctions of holy basil leaves for the next week, and take these on alternate weeks. These are the some of the lifestyle changes and diets. Medicines. Consult your doctor for medicines. If all the measures of lifestyle change fail, then only then you can go for medicine, if at all you need them after that. Otherwise, I I feel there is no need of medicines if you start applying these measures in your daily routine. Thank you very much.